So I'm going to talk you through the Motiva Preservé procedure. First of all, I'll see you, I'll assess you, we'll do your pre-op photos, and then I will do some markings on the breast, which will give us an idea of where we're going to place the implant. Then we'll take you to the operating room under local anaesthetic, we'll inject and numb the area, and then that will allow us to perform the procedure. So the first step is what we call a channel separation. So we create a channel inside the breast tissue over the muscle, and in there we're going to place our balloon. So the balloon then inflates and creates that pocket where the implant is going to go, and by doing that it causes less injury to the tissues than when we traditionally go in and we cut away those tissues or lift up the muscle. Once the pocket has been made with the balloon, we remove the balloon, and then we use a special funnel to insert the implant into the breast. And that's it. We stitch everything up, you're wide awake, you get up straight away, you walk out of the operating room, and within half an hour to an hour, you'll be back home.